Let's discuss 5 transporting points. Ying spring points, GB43, clump stream. Location between the 4th and 5th toes, proximal to the margin of the interdigital web. How to find? Locate the interdigital web between the 4th and 5th toes. Then locate GB43 slightly proximal to the margin of the web. GB43 as well as liver 2, stomach 44 are part of the EXUE10 Bafeng, proximal to the margins of the web between the toes. TV2 is located in a comparable position of the hand between the ring finger and little finger. It is also part of the EXUE9 JIAXI. Needling up to 0.5 tune vertically or 1 tune obliquely in a proximal direction. Actions indications clears heat, damp heat, and wind, especially from the opposite end of the channel. Comes liver wind. Special features, Ying spring point, water point, tonification point. GB43 is effective in treating temporal headaches from rising of liver yang. It is frequently used as a distal point for migraine headache affecting the gallbladder channel on the temples. It is also effective for ear problems such as tinnitus from liver yang rising or otitis media from exterior damp heat. Subdues liver yang, headache, dizziness, blurred vision. Benefits the ears, tinnitus, deafness, itchy ears, earache. It also resolves damp heat in hypochondrial fullness, breast abscess, swelling of limbs, redness, swelling, and pain of the dorsum of the foot. According to the classic of difficulties, Ying spring points are indicated for heat in the body. The gallbladder channel traverses the side of the head, enters the ear, and connects with the eye. GB43, the Ying spring point of the gallbladder channel, is indicated for liver and gallbladder heat which ascends along the channel to the head and gives rise to such symptoms as headache, dizziness, deafness, tinnitus, ear pain, redness, and pain of the outer canthus, and itching of the eyes. It is interesting to note, however, that although much use for one-sided headache in the modern-day clinical practice, headache is not mentioned as an indication for this point in any of the major classic texts, although GB43 does appear in point combination for head wind. Both the gallbladder, Fu, and the gallbladder channel are prone to suffering from damp heat. It is a general principle of the channels most clearly seen on the leg yang channel that the points close to the knee, especially the Hesi points, treat the internal Fu, and the more distal points, especially the Jingwell point, the Jingwell and Ying spring points, treat disorders of the channel. While not applicable for damp heat, distressing the gallbladder Fu, therefore GB43 as befits its distal location is an important point for damp heat, especially in combination with Qi stagnation, which congests the channel, giving rise to swelling in various regions of the body. In the upper body, it is indicated for swelling of the cheek or submandibular region. In the chest, it is able to treat pain of the chest and lateral costal region, breast abscess, and discharging breast abscess, reflecting both the pathway of the gallbladder sinew channel to the breast and the close relationship between the gallbladder coupled liver channel and the breast. In the lower border, it may be used for dampness and heat which sink downwards and give rise to swelling of the knee, toes, or dorsum of the foot, and damp erosion and crack between the toes. As water point of the gallbladder meridian, Valiant stream can cool, lubricate, and root the growth of wood, bring clarity and will to the urge to move up and out. Without this, there may be insufficient rooting in the yin and a lack of courage leading to timidity and anxiety ensues. Reflections may be appropriate in firming up plans, but if repeated hesitation means a decisive moment never arrives, then birth and growth don't take place. Hope is disappointed, and the The repercussion can affect a person's entire life. If the pure vitality of the gallbladder never expresses its potential and our horizon becomes smaller, we fail to live creatively and with a sense of vision. The ever onward movement of water, its wheel, is an intimate ally in the well-being of the gallbladder in its ability to move freely and live with determination and courage. When anger, frustrations, volatility of or liver fire have caused stagnation, rigidity, and drying up of growth, this point can tonify and ease the impulse of the gallbladder to forge a passage through life. As the tonification point, it promotes the Shen cycle, mother-child connections, and nurtures wood energy and its smooth flow. A branch of the gallbladder meridian passes through the chest. If there is a gallbladder deficiency, unrootedness, and anxiety, this can be unsettling to the heart. This point can calm and strengthen the gallbladder and is useful for palpitations and high blood pressure. As a yin spring point, it can flush out the meridian and clear heat. It will affect the throat, ears, eyes, and head, and so is used to ease headaches, red eyes, dizziness, tinnitus. Its ability to clear the meridian makes it useful for swelling along the meridian, swelling of the dorsum, knee, and as a distal point as well for facial swelling. Subdues liver yang, benefits the ears, resolve damp heat. Local pain for swelling of the dorsum. Tonification point, water point, yin spring, antique spring point. Not commonly used as a tonification point because wood is usually more energetically abundant than water. As a distal point, it can be beneficial for problems in the head, face, example, headaches, red or painful eyes, Bell's palsy, tinnitus, or dizziness. If water is in excess, this can give rise to swelling or puffiness in the face or on the meridian pathway itself. This water point can be sedated to cool down anger or frustrations within the person, or conversely can strengthen their resolve if there is a lack of courage. Consider if a wood CF is too brittle or rigid. Thank you for your attention.
Let's talk about stomach 43, XIANGU, sunken valley, a shoestring point. Stomach 43 is located on the dorsum of the foot in the depression between the second and third metatarsal bones at the level of the junction of the shafts and the heads of these metatarsal bones. How to find stomach 43? Palpate from distal, the toes, towards the proximal, the ankle, between the second and third metatarsal bones until the finger glides into a depression distal to the metatarsophalangeal joint, where stomach 43 is located. It is approximately on the same level as the junction of the shafts and the heads of the two metatarsal bones, needling vertically or obliquely 0.5 to 1 tsum. Actions, indications, regulates spleen, stomach, intestines, reduces edema. Special feature, shoestring point, wood point, generally used for inflammatory joint disorders, the P syndromes. This point is mostly used as a general point to expel wind and heat from the joints in painful obstruction syndrome. It resolves edema from the face. A number of classics cite stomach 43 for the treatment of edema, especially of the face and eye region. The name Sunken Valley conjures up the image of a place where water accumulates and gathers and is considered to reflect this usage. Its application in edema may be explained both by the course of the Yang-Ming channel, which governs the face, and by the intimate relationship between the stomach and the spleen, which plays an important role in the transportation and transformation of fluids. The action of stomach 43 on regulating the spleen is further reflected by its use in the treatment of barborrhigmus and abdominal distension. Stomach 43 is traditionally indicated for disorders such as swelling and pain of the dorsum of the foot and difficulty in flexing and extending the toes. In more recent times, however, stomach 43 has been used in combination with LV4 in the treatment of febrile painful obstruction in any region of the body. Febrile painful obstruction is painful obstruction which manifests with redness, swelling, heat, and pain of the joints, aversion to heat in the affected area, and systemic signs such as fever, constipation, thirst. Earth and wood dominate the middle jaw. Earth gives us form, but when out of balance, earth can fail to bring thoughts into action. Thinking processes can fail to be clear and penetrative, and the spirit of earth can get bogged down from trying to sustain and support, crumbling away at the edges or sinking in the center. The wood aspect of earth that can be accessed here is important in helping earth to get started. It helps to sustain a new beginning in a straight line. Wood can be great at clearing a path at the level of intelligent, adventurous thinking. The impulse that wood embodies takes us to the extremities and then enables us to stop there, so it can impart a sense of boundary in earth. So it is possible to say, no, attend to one's own needs without rescuing the world first. The exuberance of wood in its natural upward and outward movement can be invigorating for earth if it has become rigid or directionless. The movement of earth is from the center outward. Sometimes the vision of wood refreshes and enlarges earth's horizons. The name refers to the anatomy where the stomach meridian enters a sinking valley between the second and third metatarsals, eliminates wind and heat, mostly used as a general point to expel wind and heat from painful joints, removes obstructions from the channel, regulates the stomach, and affects the face as a distal point. Wood point, shoestring, antique summer point. Stomach 43 brings the influence of wood to the meridian, thus refreshing it and bestowing clarity and enhanced penetration of thought to the patient. For pain or swelling of the foot or heel, can be used as a distal point for facial problems such as edema. Thank you for your attention.
Let's continue with the extra point. Bafeng, 8 wind, EXLE10, and Qiuhou behind the ball, EXHN7. EXLE10 location, 8 points located on the dorsum of the foot, slightly proximal to the margins of the interdigital web. How to find? Locate the point of EXLE10, Bafeng on the dorsum of the foot, proximal to the margins of the web between the toes on the border of the red and white spleen. Liver 2, stomach 44, GB43 are all part of the Bafeng points. The extra points, XIAXI, JIAXI, are located in comparable position on the dorsum of the hand, proximal to the margins of the web between the fingers. TB2 is part of the EXUE9. Needling 0.3 to 1 tune obliquely in a proximal direction or prick to bleed. Actions indications clears heat and reduces swelling. Bafeng 8 wins. These points are used in a similar way to JIAXI for painful obstruction syndrome of the feet. It relaxes the sinews, expel wind, dampness, numbness, stiffness, redness, swelling, spasm, and pain of the toes, painful obstruction syndrome, B syndrome of the toes. Behind the ball, EXHL7, location on the lower border of the orbit at the junction of the lateral quarter and the medial 3 quarters. How to find? Divide the horizontal extension of the diameter of the orbit in quarters. Then locate the point at the junction of the first and second lateral quarters, slightly superior to the border of the orbit. Needling, ask the patient to look upward and gently push the eyeball upward, away from the lower eyelid. Slowly insert the needle 0.5 to 1 tune into the fatty tissue immediately above the bone, orbit. Caution, do not injure the eyeball and the periosteum. Avoid the venous plexus and arteries. Pay attention to any pain from needling. No needle manipulation. After removal of the needle, compress the site for 10 minutes. Hematomas may still occur. Inform the patient prior to needling. Moxibustion is contraindicated. Alternative, less difficult points for eye disorder. Bladder 2, TB23, GB1, stomach 2, EXHN5, the Taiyang, EXH, and 4, Yuyao. Actions, indications, disorders of the eye. MHN8 is a modern additional to the extra points and is used in the treatment of a wide variety of eye diseases, including short-sightedness, inflammation or atrophy of the optic nerve, glaucoma, rhinitis, pigmentosa, and convergent strabismus. Thank you for your attention.
Now let's talk about liver 4, Chungfang middle seal, which is a Jing River point. Liver 4 is located 1 chun anterior to the prominence of the medial malleolus, medial to the tendon of the tibialis anterior muscle. How to find? Even with slight dorsiflexion of the ankle, the tendon of the tibialis anterior muscle will become more pronounced on the medial aspect of the ankle. Liver 4 is located between the tendon and the prominence of the medial malleolus in a depression over the palpable joint space. Stomach 41 is also located over the joint space on the midpoint of its anterior aspect. Spleen 5 lies only slightly distal to liver 4 at the junction of a vertical line along the anterior border and a horizontal line along the lower border of the medial malleolus. Needling vertically 0.3 to 0.5 chun. Actions, indications, opens the channel, promotes the flow of liver qi, regulates the lower burner. Special features, Jing River point, metal point. Liver 4 is mostly used to promote the smooth flow of liver qi in the lower burner, and more specifically in the genital and urinary region. It is thus used for urinary symptoms with a feeling of distension in the hypogastrium, deriving from stagnation of liver qi. It also resolves dampness and treats hernial and genitourinary disorders in a similar way to liver 1 and liver 3. Liver 4 promotes the smooth flow of liver qi in the lower burner, so it's good for hypogastric and abdominal distension, umbilical pain. Resolves dampness in the genitourinary system, so for pain and reaction of genitals, hernial and genitourinary disorders, difficult urination, painful urination, turbid urine, retention of urine, swelling of lower abdomen. Liver 4 is the Jing River point of the liver channel. Like liver 1, its main action is to regulate qi in the lower jiao portion of the liver channel, specifically the genitals, the urinary system, and the region around and below the umbilicus. In the genital region, liver 4 is indicated for hypogastric pain, pain and retraction of the genitals, and shan disorder due to stagnation of liver qi. Traumatic injury or penetration of cold into the liver channel. It is also indicated for various kinds of seminal emission. The liver is entrusted with the ministerial fire, and the liver channel dominates the genitals. Sexual desire, therefore, is a manifestation of the fire of both the kidneys and the liver. The circulatory function in men is dominated by the free flow of liver qi, in the same way that it dominates the regularity of the menstrual cycle in women. Heat due to liver fire, damp heat in the liver channel, or liver and kidney yin deficiency may agitate and disturb the gate of essence, leading to seminal emission. Liver 4 is primarily indicated for seminal emission due to heat, but owing to its regulatory action on the genital region, may be used in all patterns. Thus, the classic of supplementing life recommended it for seminal emission with dreams, indicative of heat, whilst Sun Si Miao in the 1,000 Ducat formulas recommended it for seminal emission due to deficiency taxation. As a Jing River point, it is indicated for alternating chills and fever and for clearing damp heat. Although Jing River points are indicated in Nanjing 68 for dyspnea, cough, colds, chills, and fevers, indicating that the lungs have been invaded by wind, cold, or heat, or when illness has caused a change in the voice, liver 4 is not much used for this purpose. It would be more likely to be used when stagnation of liver qi has led to stagnation of qi in the chest, causing the person to sigh, or for constriction in the throat. The primary liver meridian spreads in the lung and can be used for stagnation of qi and oppression in the chest. Metal point, Jing River antique late summer point. Point used in the husband-wife treatment protocol. Consider this point if a person is lacking in self-confidence or a sense of their own identity. It brings quality to the liver official for pain and swelling in the ankles and feet, muscular wastage or paralysis. It can be effective for impotence or pain in the genital area. In spiritual terms, the Hun is said to come from and return to the ancestral realms and is kept in place and earthed by the Po, the spirit of the lungs, which itself returns to the earth upon death. Thank you for your attention.
Let's discuss spleen channel, Sinew channel. Pathway, the spleen Sinew channel begins on the medial aspect of the big toe at spleen 1. It runs along the medial border of the foot, binds the anterior to the medial malleolus at spleen 5, ascends along the medial aspect of the tibia to spleen 9, and binds anterior to the medial head of the tibia, runs along the medial aspect of the thigh, and binds on the medial aspect of the inguinal region, continues to REN3, where it meets the other sinuous channel of the foot, yin channels. At REN3, the Sinew channel separates into 3 branches. One branch runs to the genital region. A further branch ascends along the anterior midline, covering the renmi and binding at the umbilical region. It penetrates the abdomen and spreads in the costal and thoracic region. A third branch penetrates deeper into the body and ends at the spinal region at bladder 20. Clinical importance, pathology, distending pain of the big toe, pain at the medial malleolus, cramps and pain in the calves, pain of the medial aspect of the knee and thigh, pain in the inguinal and genital region, radiating to the umbilicus, thorax, and back. Indication mainly for B syndrome, painful obstruction syndrome, and V syndrome, atrophy syndrome along the spleen channel, especially along the medial aspect of the leg. The area covered by the spleen Sinew channel is larger than covered by the spleen primary channel. This explains why spleen primary channel points can also be used for disorders and diseases of the external genitalia and the umbilical region. The spleen has 5 principal functions, dominating the transportation and transformation of the liquid and solid products of digestion after they had been rotted and ripened by the stomach. It therefore plays a major role in the digestive process and production of qi and blood and the function of the intestines and the proper discharge of fluid. Controlling the blood, dominating the first stage of its formation and holding it in its proper place and preventing hemorrhage. Dominating the muscles and the forelimbs, providing vigor and bulk. Opening into the mouth and dominating the sense of taste, controlling and raising of qi to counteract sinking and prolapse. It is by virtue of this function, as well as the channel pathways discussed above, that many of these actions and indications of the points of the spleen channel can be explained. This can be summarized as follows. Treating failure of the transportation and transformation function resulting in a bulgarimus, loose stools, undigested food in the stool, poor appetite, etc. Treating disorders of the intestines such as high dysenteric disorder, diarrhea, and constipation. Treating retention of dampness and consequent qi stagnation resulting in distension and pain of the abdomen, edema, heaviness of the body, soreness of the muscles and joints, swelling of the forelimbs, difficult urination, leukorrhea, somnolence, lethargy, etc. Tonifying qi and blood, resolving blood stasis, especially in the uterus, and cooling the blood. Reinforcing the spleen function of holding blood in its proper place. Raising qi and treating prolapse. Treating dyspnea, fullness, and distension of the chest and lateral costal region, sighing, etc. Calming and regulating the spirit, treating disorders of the genitals. Thank you for your attention.
Let's continue with the anterior and lateral aspect of thorax and abdomen under location methods and tune measurements. The midclavicular line provides a further tool for reference on the upper thorax. It is an imaginary line that runs from the midpoint of the clavicle to the nipple. Since in most cases the nipple lies somewhat more laterally than the clavicular midpoint, the line tends to have a slightly oblique pathway. Stomach 13 to stomach 16 are all located on the line. In men, the nipple is located in the fourth intercostal space, lateral to the midline, while in women, the location can vary depending on the shape of the breast. Stomach 17 is located on the nipple. The mammillary line is an imaginary line for orientation on the mediolateral thorax and abdomen. It runs vertically from the nipple in an inferior direction. The points stomach 18, liver 14, and GB24 are all located on this line. The lower borders of the rib cage unite at the lower sternal border, forming the sternocostal angle. This angle and the umbilicus are the two major anatomical landmarks for point location on the upper abdomen. Caution: it is important not to mistake the sternocostal angle for the tip of the xiphoid process. The latter is attached to the sternum at the sternocostal angle, projecting inferiorly towards the abdomen. For definite identification, palpate along the costal cartilage in a superior direction to where it meets the sternocostal angle. This is the location of REN 16. The axillary line is an imaginary line for orientation on the lateral aspect of the thorax and abdomen. It runs vertically from the middle of the axilla in an inferior direction. Both gallbladder 22 and spleen 21 are located on this line. The free end of the 11th rib can be palpated below the costal cartilage at the transitional zone from the thorax to the abdomen. Location tip: the patient places his flexed elbow at 90-degree angle alongside his thorax. The tip of the olecranon will then usually be close to the free end of the 11th rib. Liver 13 is located below its anterior lower border. By palpating along the iliac crest in an anterior and inferior direction, the anterior superior iliac spine, ACIS, is reached at the lateral end of the inguinal groove. The ACIS is felt as a distinct bony ridge. GB27 is located anterior to it, while GB28 is located slightly more inferiorly and medially. The upper border of the pubic symphysis is an important orientation point for point location on the lower abdomen. The distance between the center of the umbilicus and the upper border of the symphysis can be divided into 5 proportional chun, which can differ significantly from the patient's finger chun. REN 2 is located on the anterior midline and on the upper border of the pubic symphysis. Thank you for your attention. Now let's talk about DU26, Ren Chung, man's middle, Sun Si Miao ghost point. These points were formulated by Sun Si Miao in his 1,000 golden ducats prescription. These points were used for severe mental illness, such as manic depression or psychosis. The Sun Si Miao's instructions were to needle the left side first in men and the right side first in women, and withdraw them in the reverse order. Use 1 point at a time in succession. The points REN 1 and human are not needled, but direct moxacones are applied to them. So we have the 13 ghost points, DU26, lung 11, spleen 1, pericardium 7, bladder 62, DU16, stomach 6, REN 24, pericardium 8, DU23, REN 1, the extra point human, LI11, the extra point high chuan. DU26 is located below the nose on the upper third of the philtrum. Note, water grave is an alternative name for this point. How to find DU26? Locate the philtrum, which forms a distinct groove on the midline between the root of the nose and the margin of the upper lip. Locate DU26 slightly superior to the midpoint of the philtrum. LI19 is located on the same level, 0.5 tsun lateral to the midline. Needling 0.3 to 0.5 tsun obliquely in a superior direction. Caution, needling this point may be painful. Actions, indications, revives consciousness, benefits the face and nose, eliminates external wind, benefits the spine. Special features, meeting point with LI and ST channels, Sinew ghost point, major point for acute emergencies. Needle with strongly reducing technique. If no acupuncture needle is available, use a syringe or perform strong acupressure with the nail of the thumb or index finger, supporting the patient's chin with the same hand. Can be used in cases of needle collapse. First, remove all other needles. DU26 is used to promote resuscitation when the person is unconscious. Like DU23, it opens the nose passages. An empirical use of this point is as a distal point for acute sprain of the lower back, but only when the pain is on the spine itself. In these cases, it is usually reduced when the patient is standing and gently bending backwards and forwards. DU26 regulates the water passages of the upper burner and can therefore resolve edema of the face and hands. Its alternative name, water ditch, is related to this function. Promotes resuscitation and extinguishes interior wind, loss of consciousness, coma, wind stroke, lockjaw, deviation of eye and mouth, and epilepsy. Opens the nose for nosebleed, clear nasal discharge, loss of sense of smell. Calms the mind and opens the mind's orifices for manic depression. Benefits the lumbar spine. Stiffness and pain of the lumbar spine in the midline, inability to bend forward. Regulates the water passages of the upper burner, edema of the upper part of the body. The powerful effect of DU26 on restoring consciousness is mirrored in its equally strong effect on calming the mind. The governing vessel both enters the brain and connects via its anterior pathway with the heart. DU26 is an important point in the treatment of severe psycho-emotional disorders and is indicated in classical texts for unexpected and inappropriate laughter and crying. The importance of DU26 in the treatment of mania disorder and epilepsy is reflected in its inclusion under its alternative name of Ghost Palace among the 13 ghost points of Sun Si Miao for the treatment of mania disorder and epilepsy. According to the Ode of Qiuhou, the ability of DU26 to treat mania disorder is supreme. The 13 ghost points must not be overlooked. So DU26 is the crossing point of Jumai, Renmai, Li, and stomach, and it is a ghost point. Another powerful point that goes to the very center of our being, as it sits between the nose, which receives the heavenly chi, and the mouth, which receives the potential for earthly chi, with humankind in the middle, along with DU27 and DU28, it helps regulate the yin-yang balance within, especially if there is severe oscillation of emotion or mood, such as bipolar disorder or mania. Consider when the patient is not whole within their spirit or when a degree of possession is suspected, used as a resuscitation point for loss of consciousness. Thank you for your attention. Okay, now let's talk about diagnosis for constipation. When diagnosing the causes and type of constipation, it is important to take into account the following factors: stool shape, moisture of stools, pain, effort of defecation, and color. Stools which are round and small like pebbles indicate heat, if they are very dry, or liver qi stagnation if they are not dry. Long and thin stools like pencils indicate spleen qi deficiency. It should be kept in mind that they may indicate carcinoma of the bowel. So we have here the normal stools illustration, stools in liver qi stagnation, and stools in spleen deficiency. Dry stools indicate heat or deficiency of yin. Apart from other symptoms and signs, thirst and dryness of the mouth are important differentiating symptoms. With heat, there is intense thirst with desire to drink large amounts of cold water. With yin deficiency, there is only a dryness of the mouth with desire to drink water in small sips. Loose stools that are hesitant and difficult to expel indicate spleen qi deficiency with stagnation of liver qi. Watery, explosive stools splashing in all directions indicate either damp heat, in which case the stools are yellow and frothy, or cold dampness. Constipation with abdominal pain points to stagnation of liver qi or cold. Pain from stagnation of liver qi is not too severe and is accompanied by pronounced distension. Pain from cold is severe and spastic. Difficult defecation with great effort indicates deficiency of qi or yang. This is also confirmed by a feeling of exhaustion after the bowel movement. Cramps after defecation indicate cold or stagnation of qi. Pale stools indicate dampness, usually damp heat in the gallbladder. Dark stools indicate heat. Green stools in children indicate cold. Thank you for your attention.